What causes diabetes? This is an important question, especially when somebody newly diagnosed with diabetes, they don't have a family history. They're really very curious and surprised and shocked to ask why diabetes came to me, what really caused diabetes to me. I will summarize. See, diabetes is not something new. The earliest mention of diabetes was there in Atharva Veda times, in nearly 1000 BC. And even Ayurveda mentioned that diabetes can be caused by imbalances in the three doshas. Fundamentally, there are two types of diabetes, type 1 and type 2. Type 1 diabetes is something which we see in the children's, where the real problem is insulin deficiency. The pancreas in our body is not able to set adequate quantities of insulin. So that is type 1 diabetes, and this overall constitutes 10% of diabetes. Rest 90% of diabetes is type 2 diabetes. So what causes type 2 diabetes? Type 2 diabetes, contrary to type 1 diabetes, is not because of insulin deficiency. Remember this, type 2 diabetes in 90% of the cases is because of insulin excess. That means there is more and more insulin in the body, hyperinsulinemia. That insulin becomes resistant, called as insulin resistance, that's unable to control the sugar in our body, leading to diabetes. So type 2 diabetes is mainly caused in 90% cases by insulin resistance. So to address what causes insulin resistance, that indirectly says why we get diabetes. Insulin resistance is caused by overweight, obesity, chronic stress, some genetic influences, and some part of it can be hereditary, but most of it is by our overweight and obesity. Of course, there can be some people with a thin build has insulin resistance also. So fundamentally, diabetes is a sugar disease. So we have a more sugar when insulin is not able to control. In spite of more insulin, we get a diabetes.